Good morning, everyone. I am going to talk about the COVID-19 coronavirus effect to Sri Lanka and the global world. Now we can categorize about four parts of COVID-19 effect to Sri Lanka and global world. The first one is global context of COVID-19. Second one is Sri Lankan situation of COVID-19. Third one is virus variation of COVID-19. And the last one is vaccines for COVID-19. First, we can talk about in detail of the COVID-19 coronavirus. The first one is global context of COVID-19. COVID-19 global context. In global, COVID-19 is spread quickly in most of the countries today. This chart shows the average of COVID-19 patients by continent in all over the world today. Consequently, trade and travel have been recognized as significant determinants of the spread of disease. Additionally, the rise in urbanization and the closer integration of the world economy have facilitated global interconnectedness. Therefore, globalization has emerged as an essential mechanism of disease transmission. This aims to examine the potential impact of COVID-19 on globalization and global health in terms of mobility, trade, travel, and countries most impacted. This chart shows the COVID-19 cases compared by continent. The COVID-19 pandemic is fastly spread in India nowadays. The coronavirus cases reported in India 2 crores and 92 lakhs and 74,823 and deaths reported at 3 lakhs 63,097. Deaths percentage is 1%. This chart shows the total number of cases of COVID-19 in India. The second one is the Sri Lankan situation of COVID-19. These two charts shows the daily new cases in Sri Lanka and daily new patients in Sri Lanka. Sri Lanka periodically faces epidemics of infections that cause morbidity and mortality. There is epidemiological data on specific diseases such as leptospirosis and dengue. Through clinicians observe periodic epidemics of influenza and other respiratory illnesses. There is scarce information on their spread and case fatality rates. COVID-19 was detected in a Sri Lankan tour guide on the 10th of March 2020. However, the country had not been impacted by SARS and MERS. Significantly, that emerged 2 decades ago, since those outbreaks were contained and they had not spread across the world to become a global pandemic. The third one is virus variation in COVID-19. This chart shows the World Health Organization names key variants of COVID-19. The country scientific name and World Health Organization name are separated in this chart. The first variant is UK variant. The scientific name is B.1.1.7 and World Health Organization name is Alpha. The second one is South African variant. The World Health Organization name is Beta. The other one is Brazil variant. The World Health WHO name is Gamma. The other one is Indian variant. WHO name is Delta and the other one in Indian variant WHO name is Kappa. When a virus replicates or makes copies of itself, it sometimes changes a little bit, which is normal for a virus. These changes are called mutations. A virus with one or more new mutations is referred to as a variant of the original virus. WHO renames COVID-19 variants with Greek letters to avoid stigma: Alpha, Beta, Gamma, Delta. The World Health Organization announced the new naming system that is devised for so called variants of interest and variants of concern. the forms of the SARS-CoV-2 virus with important mutations. This slide shows vaccines for COVID-19, and this photo shows the Sputnik 5 vaccine and AstraZeneca vaccine. This slide shows vaccines in global world and uh, in detail details about Oxford AstraZeneca vaccine, Pfizer vaccine, and Sputnik 5 vaccine. The manufacturer is Oxford AstraZeneca is AstraZeneca University of Oxford, and research name is AZD1222, and Pfizer vaccine name is BNT162B2, and manufacturer is Pfizer Inc. and BioNTech. Type of vaccine name is mRNA. The other one is Sputnik 5 vaccine. The manufacturer name is Gamaleya Research Institute, and research name is GEM COVID vaccine. Vaccine type is non-replicating viral vector. This vaccine are used to control COVID-19 virus, and uh, finally, I hope you will know more details about COVID-19 coronavirus, and thank you very much.